In this section of the online course, we're going to look at chest exercises that can be used for prehab, for mobility and rehabilitation. This is very, very important for most of our general population, especially if you're a gym goer and you spent years upon years doing lots of bench press. By doing too much bench press, it can really tighten up the anterior pectoral region. And because it's so tight, it pulls the shoulders forward, and that can create neck pain, back pain, and lower back pain. So we're going to show you a whole series of exercises that will loosen up the pectoral region, make it looser, and make it a lot more pliable, so the shoulders and the chest can sit back in that original position. The first exercise in our chest mobility and rehabilitation section is a med ball roll on the pec. So obviously you're going to need a medicine ball for this. Now the reason for doing this exercise is if our chest gets very tight for whatever reason, maybe too much bench press in the gym or just overall tightness, using the med ball to break up the muscle tissue then allows us to do a lot more dynamic exercises. So how we do this exercise is we do each section of the pec individually. So I'm going to do the right side first. So I place the med ball on the right side of my pec. I lift up my right hand and place it in my lower back. I use my left hand just for stability, and then I very carefully roll out the entire pec region. So the middle of the pec, the top part of the pec, the lower part, and this part's really important, where the shoulder joins the pectoral muscle. That joint there, that's where a lot of stiffness occurs. We roll that out for roughly about 1 minute. When I've done my right side, I'll then switch to my left side. So the med ball goes over to the left pec. Right hand is held for stability. Left hand goes to the lower back. And same thing, I'm rolling out that left pec in the middle section of the pec, the high part, the low part of the pec, and again, really importantly, where the left shoulder meets the left chest muscle or the left pec muscle. And I roll both sides out for 1 minute. The side-to-side chest stretch. This is a really dynamic stretch that will, once you've broken up the muscle tissue from the med ball exercise, it'll really loosen up the pectoral muscles. So how you do this exercise is you get our knees positioned roughly hip or slightly wider apart. We put our 2 feet together in the back, and then we place both of our hands outside our shoulders, okay? And then we spread our fingers. To start the exercise, we're going to rotate the whole entire body to our left-hand side, while the right arm goes flat on the floor. We come back up, we turn to our right side, and the left arm goes down to the floor. And we continue this for 12 to 15 reps. And you will discover, as you work through the rep range, your range of motion in your pec area will increase, allowing you to get deeper and further into the stretch. And by doing this for a set of 12 to 15 reps, it really opens up the chest area and creates great mobility in the chest region. That's the chest side-to-side stretch. Underhand band pull-aparts. So how we set up for this is we obviously get a band first of all. Foot position is feet shoulder width apart. We slightly soften our knees to take the pressure off the lower back. And what will really help is if you switch your core on. So pull your belly button into your spine and really brace your abdominal muscles. Grab the band outside the thighs and turn your palms up towards the ceiling. We start with the elbows straight and we pull that band apart to bring the band into the chest, at the same time squeezing the shoulder blades together. Then we reverse that movement back into the start. Keep the pressure on the band, pull the band into the chest, pull the shoulder blades together and return to the starting position. Start with the elbows straight and we pull that band apart to bring the band into the chest. Then we reverse that movement back into the start. Keep the pressure on the band, pull the band into the chest, pull the shoulder blades together and return to the starting position. That's called the band pull-aparts with underhand grip. the underhand band dislocations. The setup for this exercise is get a band, get our feet shoulder width apart, slightly soften the knees, and then switch our core on by pulling our belly button into our spine and really bracing the core. We take an underhand grip on the band just past the thighs, and then to start the exercise we begin raising the band up with straight elbows up past our face as we start to pull the band apart. The band goes above the head, round the back of the head and the shoulders and into the lower back while we're keeping the band pull apart, and then we reverse that movement back to the starting position. We begin raising the band up with straight elbows up past our face as we start to pull the band apart. The band goes above the head, round the back of the head and the shoulders and into the lower back while we're keeping the band pull apart, and then we reverse that movement back to the starting position. So band touching the thighs, we begin by pulling the band apart past our face, up over our head, keep the band pulled apart, round the back of the shoulders and back round to the starting position. And this exercise is called underhand band dislocations. Angle band pull aparts. So obviously you need a band for this exercise. So our setup for this exercise is feet shoulder width apart, slightly soften the knees, switch our core on and really brace the abdominals. Get our band at an angle, roughly around 45 degrees, right hand on top, left hand on bottom. While we really make sure the core is switched on, we pull the band apart and return to the starting position. So we pull with the right hand and pull with the left hand, pulling that band into the body and return to the starting position. We pull the band apart, pulling that band into the body and return to the starting position. And then we change the angle. This time left hand goes on top, right hand goes on bottom. When doing this exercise, for as much as you can, try and make sure your elbows are straight. So we pull apart at the new angle. Right hand goes down, left hand goes up, back to the starting position. And again, left hand goes up, right hand goes down, band comes into the body, back to the starting position. This exercise is called the angled band pull apart. The exercises you've just seen are fantastic in creating big mobility in the chest area. Also, they're excellent for prehab or rehab exercises if you've picked up an injury or trying to prevent injury in the future. You might have noticed in the shoulder section of this online course, due to the proximity of the shoulder region and the pec region, that some of the exercises cross over, and that's fine. Because both areas work in tandem, they're both excellent for creating that mobility, strengthening for rehab and strengthening for prehab.